You know, in Indonesia, podcast is very popular.
Really? Oh, I first time know that. Yeah.
If we have a trouble, we go to podcast.
Wow.
There's a lot of people in Indonesia go to Korea.
Okay.
I heard that a lot of Indonesian people and a lot of actresses go to Korea. Go to your clinic, is it right?
Yeah, they come.
Which actress in Indonesia go to your clinic? Spill it.
Bone surgery, I don't, because her the angle, the camera angle is not big.
Okay.
I'm not sure, but maybe
he
know
do it.
I don't know.
Jaw surgery, okay.
Maybe not 100% I can commit, but yeah, maybe.
You know it. She's a man.
She's a man. What is that? Really? Maybe I think so. Yeah.
Seperti janjiku, hari ini kita ada kolaborasi internasional dengan sahabatku, Dokchun. Itu dokter bedah kosmetik terkenal di Korea. Jadi banyak artis Asia itu operasi dengan dia. Dan hari ini dia datang khusus ke Jakarta untuk ke podcastku. Assalamualaikum.
Assalamualaikum. 안녕하세요.
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 Assalamualaikum means may peace upon you. May peace be with you. This is a Muslim.
Muslim.
So if I said Assalamualaikum, you must answer it Waalaikumsalam.
Waalaikumsalam.
Okay. We'll repeat it again, okay?
Okay. Waalaikumsalam.
Assalamualaikum.
Assalamualaikum.
No. I said Assalamualaikum and you said Waalaikumsalam.
Waalaikumsalam.
Okay. Assalamualaikum.
Waalaikumsalam.
Perfect.
I'm an Indonesian now. I feel like.
Wow. You're more handsome.
Oh, thank you.
How old are you?
It's a secret.
Are you sure you're a doctor, not a model, not a K-pop star?
Yeah, doctor and DJ.
Yeah, doctor and DJ. Not a K-pop.
K-pop?
Yeah, K-pop. You know K-pop? Idol.
K-pop idol. Yeah, I have some friends, but they are really handsome. Very small face, really handsome. Yeah.
Oh yeah?
Yeah.
Okay.
Yeah.
How are you? Apa kabar? You know apa kabar?
Yeah, no, baik.
Wow! You can speak in bahasa?
Just a little bit, yeah, not much, right?
Okay. How many times you go to Indonesia?
About 4 or 5 times.
4 or 5 times?
Yeah,
okay.
I remember, yeah.
Jakarta?
In Jakarta here.
Jakarta here.
Yeah.
What are you doing in Jakarta?
For give lectures to doctors and enjoy.
Okay.
Rest.
Okay. And what's your favorite food then?
My favorite
Nasi
food.
goreng?
Yeah, how do you know that?
Oh yeah?
Oh, he knows everything about me. Nasi goreng is my favorite, really.
You like nasi goreng?
Yeah, very famous, very delicious.
I serve traditional food in Indonesia. After we podcast, we must eat it.
Okay.
We call it ketupat.
Ketupat. No?
Ketupat. Actually, I buy him a shirt, Muslim shirt. Maybe sebenarnya aku beliin dia baju Muslim, baju koko juga biar samaan dengan aku. Tapi ternyata his body is very big.
No, not big, but I feel like it's very good because the wind comment out very nice, very. Yeah,
Okay.
I think so.
But you have a 6 packs too.
Well, not exactly. This one sometimes it appears.
Handsome, a doctor, a DJ.
Yeah.
What a combination.
Yeah. I'm only bit shy.
Okay, let's talk about the doctor.
Yeah. Okay.
You're a doctor in Korea,
Yes.
right? Can you tell me how to be a doctor in Korea? How long it takes? How tough is it? And how much cost to be a doctor?
Doctor. Yeah. I think it's a little bit different with Indonesia. In Korea, medical student, as a medical student, 6 years.
6 years?
Yeah, 6 years.
To be a doctor?
Yeah, after the doctor degree, and they go to intern. Of course, if they doesn't want to intern, they can go out for local market. But mostly, they go to the internship 1 year.
For what? Internship? Or
for intern in the hospital, for 1 month at cardiology, 1 month at the general surgery part, like the experience. And after that, they choose their specialty for 4 years of the residency.
Oh,
So yeah.
so internship for the specialty.
Yeah, internship of all the department 1 year, and after that 4 years of the specialty only one department. They choose. Yeah.
But after 6 years, we can do some.
Do all the things that doctors can do, but it depends on the doctor's ability.
Okay.
Yeah.
But in Korea, if the major faculty, what's the favorite one? Is it a medical doctor or engineer or something? Which one favorite?
Now the most popular is orthopedics and dermatology, plastic surgeon, and others are changing because at the Corona season, the ENT doctors are very. The flows are make some more popular.
After we have a high school and then we choose.
Yeah.
Is it doctor is favorite, the most favorite one?
Not now, but I saw some research. They want AI like that now in Korea very fast. AI making more YouTube making.
Okay.
And doctors it was a preference 4 or 5. Yeah, 4 or 5.
Number 4 and number 5.
Not number 1. Yeah.
Okay.
Yeah.
Is this the first time you go to podcast?
Podcast? Yeah, it's my first time.
in Korea, there's no podcast.
Podcast, not really many, but only the broadcasting, not the personally not like this, but yeah.
So the in Korea, podcast is not popular.
Not popular, but
You know, in Indonesia, podcast is very popular.
Really? Oh, I first time know that. Yeah.
If we have a trouble, we go to podcast.
Wow, discussion about some issues here.
Yeah.
Like, wow.
It's like news in television, but we chit chat here and we record every day.
Every day.
You know, my podcast is almost every day.
Wow. It's a very, very nice kind of small talk, not very, in the broadcasting, we have to very severely think and talking. And
we just chit chat like a friend.
Yeah, it's much better, I think.
you can do podcast in Korea.
Yeah.
Maybe you're a pioneer.
Okay, I will take this format to Korea.
So how much it costs to be a doctor in Korea?
Korea. It depends, but I think 1 billion. 1 billion rupiah.
1 billion
rupiah to be a doctor overall, I think. Yeah,
okay.
All the things and living earnings, many things, all included, I think.
And you are a cosmetic surgeon, right?
Yes.
What is the difference cosmetic surgeon and plastic surgeon?
It's a terminology because plastic surgeon, we said certified. Board certified means they had 4 years of the residence of the plastic surgery department. But I joined to residence 1 year of the plastic surgery, but I quit. And I come out to local market for fast because
why?
Because I many regions, but I wanted to experience more fast about the cosmetic market because it changes very fast.
Okay,
yeah,
so you finished the doctor in 6 years.
Yeah, of course.
And you do internship 1 year, and then 4 years for plastic surgeon.
But only 1 year.
But you only 1 year.
1 year
and then you be a cosmetic surgeon.
Yeah, but cosmetic surgeon is a kind of terminology. Aesthetic surgeon, cosmetic surgeon. I don't know other countries they call, but it's all commonly we say cosmetic surgeon or aesthetic surgeon like this.
What treatment that you can do when you are a cosmetic surgeon? You can do nose job.
Yeah, every day I do nose more than 5 patients.
Oh yeah?
Every day, yeah.
Facelifting?
Facelifting sometimes.
You can do it?
Yeah, once in a month.
Breast?
Breast, yeah, not much, but it's a hospital.
But you can you can do it in your clinic.
Yeah, of course. Yeah, Botox lift, all the things.
What is double eyelid?
Double eyelid, yeah, every day.
What? Jawline?
Yeah. Bone surgery.
Bone surgery.
I don't do bone surgery, only the zygomatic sometimes, but I'm not specialist here.
You can do it.
Yeah, you can. I can do it in low, no problem.
Oh, in low, no problem.
Yeah, it's a
So
difference.
what is the difference cosmetic surgeon and plastic surgeon?
No difference. But people, the patient believe there's a plastic surgery society. The plastic surgery specialist, they can search. Oh, for example, Dr. Chun search. Oh, he's not a plastic surgery specialist, but he's doing the cosmetic surgeries, blah blah blah. They search the result. Oh, it's good. They come or they choose. Yeah.
Okay.
Only that. Yeah. Not the in-law, nothing. Yeah.
Okay.
Yeah.
And how much to be a plastic surgeon in Korea?
1 year, about when I was resident in the plastic surgery department, 1 year, about 80 plastic surgeons only in Korea. 1 year, they come out, the specialists.
Okay.
Yeah.
Is it hard to be a doctor or plastic surgeon in Korea?
Doctor?
The chosen one or everyone can do it? Everyone can...
Yeah, of course, doctors all over the world, doctors are already having a hard time because they cannot go outside. Well, in Korea, 1 or 2 exams in 1 week. Every week they have examination. And for boys, we have to go to 3 years or 2 or 3 years of the army on duty. So after 3 years army and all the courses finished, then go out with specialty. Their age is 34 already. They old already.
Okay.
Yeah.
How about the competition to be a doctor in Korea? Is it this is the son of our teacher? This is the son of
To be a doctor?
yeah. To be a resident, maybe to be a specialist.
Specialist. It's very.
There's a discrimination in Korea too.
A little bit. I think because I experienced something.
Just a little.
But normally not. Normally they think are fair. Of course, there's there's scores of their internship. But if which student they pick is depend only the professor.
Depends on the department.
Yeah, the professor. Yeah. Now, no course. The score is not important.
But you have a feeling, like you have a feeling.
Maybe. Yeah.
This is the son of. This is the son of.
Son of someone. Yeah, I feel something. Yeah, everything is like this, right? So. Yeah.
Okay, and let's talk about the treatment.
Yeah.
What is the non-surgical treatment are trending in Korea right now? In Indonesia, beauty benchmark is Korea. So what is the trending treatment non-surgical in Korea?
Now arising is a collagen stimulating injections.
What is collagen stimulator?
Collagen stimulating means, for example, polymers made in some polymers they can insert in our body, making collagen. Yeah. Aren't you using any collagen stimulants too?
Yeah.
Yeah,
it's very favorite. One of my favorite treatment in my clinic. We call it collagen stimulator.
Which brand do you use?
I use Juvelook.
Juvelook.
What is you use in? Can we set brand in here? What brand you use in Korea?
Yeah, I use a lot, but mostly Juvelook because the patient come and I want to Juvelook because they heard it's good.
Oh yeah?
Yeah.
I heard that Juvelook is a very famous brand in Korea.
Yeah, there was an issue because 2 or 3 years ago, all the patients want to Juvelook. So doctors have to buy Juvelook, but they have nothing. Already sold out. So we have to call the product company. Please give me one box, please. They kind of, wow. So sold out. We couldn't buy.
Oh, okay. In Indonesia, Juvelook is presented by Krisdayanti. Krisdayanti is a diva in Indonesia. Yeah, is a diva. Is a big actress in Indonesia.
Oh, yeah.
Yeah. But I like Juvelook because it's the result is very natural.
Yeah, very natural. Yeah, and collagen stimulants like that, the polymers. Before, we cannot inject to the skin dermis itself because it could be some problems. But after Juvelook, we could inject intradermis.
You use inject.
Inject.
Not using canal.
Cannula means the device.
Cannula is
Cannula.
yeah.
Juberec is two, like the volumization using the cannula, but Juberec skin. I don't know. Juberec skin is maybe the blue label.
Okay.
They use the dilution and inject with the needle.
Oke, jadi di sini ada sedikit different teknik ya. Kalau dia suka gunain jarum ya. Jadi di sini ada sedikit perbedaan teknik ya. Jadi kalau dia lebih suka pakai jarum, kalau aku sih pribadi sih aku lebih suka pakai kanul ya. Jadi biar hasilnya itu tergantung sih cara penggunaannya, tapi dua-duanya oke. What is the price of collagen stimulator in Korea?
In Korea, for example, for Juberec, one ampoule, it depends. 50만 원 to 100만 원, how to say?
It's okay, in one.
In one.
We have a calculator.
Okay, make some. Okay, so it depends. Some clinics sell by cc, but you know the dilution method. One ampoule about 5 to 6 cc.
Yeah.
So sometimes 8 cc. It depends on clinic.
How much you charge it to patient?
Minimum 1 million won.
Oh.
Yeah.
It's so expensive.
Yeah, very expensive procedure because we do the very detailed for acne treatment like that. Yeah.
You know, in Indonesia, we just charge it 5 million rupiah. I think it's how many ones?
5 million rupiah is 50만 아닌가요? 맞죠?
Okay. It's cheap or expensive?
It depends the technique because if you do dilution and takes a lot of time, then high price. Yeah.
Okay.
Because the market is not judge only the price and the doctor because we do.
Oh, the skill is very important.
Very important. Yeah. I want to ask you something. So in Indonesia, besides the collagen stimulator, what's the hottest product or things at your clinic?
What is?
The hottest thing at your clinic.
The hottest. Okay,
yeah,
the favorite one. In my clinic, my favorite one is exosome. Facial peeling exosome because it's without needle and there's an injection too. It's an exosome. Exosome is kind of stem cell. One of the product of stem cell, exosome. And is it popular in Korea?
Yeah, very popular.
Oh yeah?
Very popular. Yeah, the super popular in Korea. And what brand do you use at your clinic? Because more than 20 brands of exosome in Korea now, but only a few things are best, I think.
Oh yeah? I use from Korea too. I don't know you know about it or not. Asche.
Yeah, I use that too.
Oh yeah?
Yeah. Exosome mate.
It's very incredible.
Yeah, very nice.
I like Asche. Asche itu aku ngomongnya gini ya. Asche itu exosome. Jadi dia itu bagus banget. Jadi fungsinya itu bukan untuk ngilangin flek ya teman-teman ya. Jadi dia itu kalau misalnya dioles atau di facial atau penggunaan treatment dengan menggunakan Asche itu, dia bisa menghilangkan redness, kemerahan. Jadi kayak dia tuh penghubung antar jaringan, sehingga jaringan kita tuh jadi lebih sehat, jadi lebih bagus. Skin barrier kalian tuh jauh lebih bagus, sehingga kayak masalah-masalah kalian seperti pori-pori, flek, kemerahan pada kulit itu akan berkurang dengan sendirinya. Jadi dia nggak nyembuhin, tapi karena kulitnya itu jadi lebih sehat, jadi masalahnya itu akan berkurang dengan sendirinya. There's a lot of people in Indonesia go to Korea. Okay, I heard that a lot of Indonesian people and a lot of actresses go to Korea. Go to your clinic, is it right?
Yeah, they come.
Who is? Which actress in Indonesia go to your clinic? Spill it.
Later I should, but it's a privacy of the patient, so I cannot say it publicly. So, and we have to protect them, right? As you know, many celebrities from Indonesia and Jakarta go to clinic too.
Okay.
Right? Okay. Tell me.
Not only. Yes, it's a private. Yeah, it's private.
Yeah.
Which country the most favorite go to your clinic?
Now in Japan.
Japan.
Yeah, Japan. Many patients from Japan come to my clinic because, for example, for Ulcera, the price is 3 times higher
in Japan.
In Japan, and they come with the airplane in the morning. And they get procedure and go back, but it's more cheaper.
Okay.
In Korea.
Which one cheaper, Indonesia or Korea, for the aesthetic treatment?
I don't know the price of Indonesia. How much I don't know. So I cannot judge.
So we can compare it. How about facial in Korea?
Facial.
You do some treatment of facial for deep cleansing.
The cleansing. Not the procedure, but
no,
cleansing.
just deep cleansing.
Deep
do
cleansing.
It by beautician, not a doctor.
About 15만 원, 20만 원, 바쁠 땐 30만 원.
How much that?
모르겠네.
1,5 juta. Okay.
Yeah.
More expensive. Okay. How about chemical peeling? You do chemical peeling?
Chemical peeling?
It's a simple procedure in...
simple procedure. Yeah. More, some peelings. Yeah.
Okay. How much? How much you do?
25만 원? 30만 원?
2,5 juta is too expensive. You know.
But all together, after peeling, do more some good LDM, 진정 관리, how to say, calm down.
Okay. Okay. In Indonesia, I charge it about 1 and 1.5 million rupiahs. Okay. 1.5 but my clinic is very a little bit high end, so it's a little bit expensive than another clinic. So the other clinic is more cheaper.
Your clinic is higher.
Yeah, because my clinic is very good.
Yeah, this is so massive. I saw you.
Is it the Korea? Is it usual we see 23 clinic or 20 clinic?
Yeah, the branch. Some clinics have the many branches. For example, 50, 60.
Oh yeah.
Yeah.
Some brand have
some brand they brand many
clinic. How about you?
Me?
How many clinics?
We concentrate only one clinic, the best quality. No, we don't do branching. No. We only provide the best quality, best technique.
Okay. What you usually do to the actress? What they ask for you? Is it nose or chin or something?
For surgery?
Surgery.
For surgery. They come, it depends on their, but already the actress and idol, K-pop idols, they do, near here is very important for the nose. But for nose, I don't open rhinoplasty because they don't want to hire now, no more. Now, more narrowing the tip of the nose, the width of the nose tip, narrow something like very naturally. Natural means the connection of the ear here, the all natural. So they want the natural thing.
Do you do the surgery procedure?
Me?
Yeah.
5 years ago, I had only double eye fold.
Double eye.
Yeah, no incision method because I have asymmetric. Yeah. Only that.
I heard that in Korea, people so easy to doing surgery. Is it right?
Yeah, I think it's very easy because there's a Gangnam Station. Gangnam Station. Near there, all the medical buildings, all the hospitals. One building, about 5 to 7 hospitals.
No.
One building.
I think somebody tell me that in Korea, people is easy to doing think about the procedure. Yeah. When they high school, they talk, I want to have a double eyelid. I want
because their mother.
Yeah.
Double eye for girls after they graduate high school, they go to double eye for their mom. Okay, they have double eye fold, and about 20 years later, when they get married, about their 40s, they go the upper eyelid surgery, and after their 20 years later, they do forehead lifting.
Okay.
Yeah.
But in Indonesia, it's still taboo. Tabu. Benar ya, tabu ya, tabu. Is this because in Indonesia still as a Muslim country?
Yeah.
So change the first is still taboo.
Taboo. Yeah. No change. Natural looking, the natural bone, right?
But you see my face. What is the best you can do to my face?
I
want to be an idol in Korea. Is it? You can do it? How much?
Okay, I try. I try.
Okay.
Really? Maybe I think. Okay.
Perfect. Oh, thank you.
No. Calculator. Give me calculator.
Oh, calculator. Oh my God.
I cannot. Oh, sorry. Yeah. Okay, just kidding, right?
Yeah, it's okay.
Yeah, it's okay. But I think so. About more than 40 or in their age, I think no more change of the shape. It's now going to anti-aging therapy.
Okay, this year is my age is 40.
40.
Which one you want to change of my face so I can become an idol in Korea?
Idol? Okay. I think if you do, okay, here a little bit fat, a little bit fat and sagging, yeah, contouring here, and the nasal layer for them.
I want to remove it.
But you do still, sometimes you do yourself?
Yeah, is this like my mom?
Your mom?
There's a fat in here. I want to reduce it, but I don't have time to go to my clinic.
But you can bring your machine to your home.
Okay. Okay. Which one again?
Maybe you have ptosis, right? A little bit ptosis.
Okay.
But maybe more a little eye, not
double eyelid.
Not double eyelid, but non-incisionally, maybe but more because this one is from here.
Okay.
Or something like that. Yeah.
The other? Facelifting? How about facelifting?
Facelifting? No, I think not facelifting. Not your age. I don't recommend. Yeah.
Okay.
Yeah.
Nose, lips, chin.
Okay, give me calculator again. Okay. Today I make a lot of money.
So how much it costs? How much it costs? Is it 1 million? 1 billion is enough.
1 billion? Okay, I'll try. Okay. 1 billion.
Is it not enough?
No, it's enough. But it's a long plan. Just one surgery, finish, it's not.
You cannot do it in one times.
At one time, more surgery, big surgeries at one time. But if you do, for example, facelifting, you do it. But here, from the distance from, if you apart from the incision side, this sagging is still
okay.
So collagen.
But you can make me handsome, like Lee Min Ho. You know Lee Min Ho?
Yeah, I know, but I try. It's a limitation, but okay, I try. It looks like, looks like.
Somebody tell me that every girl, every woman, after have a surgery in Korea, they look the same.
It's a kind of rumor.
Like a sister.
Like sister, yeah, because
same nose, same lips, everything is same.
Yeah. There was a webtoon. Webtoon is animation like that. Because 10 or 20 years ago, there was a big hospitals about 15 years ago. They the plastic surgery hospitals, big hospitals was like a factory. Yeah, because they surgery every day, about 5-10 surgeries. So almost same result. But standardization it was very important for running the hospital. So the kind of result was. But now, big hospital doesn't do it like that.
Okay. Yeah. Now it's a little bit different.
Yeah, and patient doesn't want that too. Patient before, I want to do like this, but now it's all different.
Okay. Which one the best plastic surgeon in your opinion? What country? Indonesia, Korea, Japanese, or Thailand?
Yeah, it depends
in your opinion.
Yeah. For example, body. For body, of course, Brazil was very famous. Brazil. Oh, Brazil was famous for the good shaped body. And Thailand, of course, very nice quality because they have many transgenders and they all like that.
Okay.
And for I know around here, total, I think Korea cosmetic surgeons, plastic surgery is very high level. And Turkey, Europeans go to Turkey because Turkey surgeons are very nice.
For hair.
Yeah, for hair and nose, very nice. And the price is important too because the price is low, then the doctors have many experiences. Yeah,
okay. Have you ever had a treatment go wrong? Fail?
That kind of things sometimes happen, but I think no effect, no side effect. But more effect, sometimes side effects sometimes come together. But if I can't handle the side effect, then it's no problem.
Okay.
So before, before doing something like that, let the patient know that.
Okay.
Yeah, that kind of stuff we can control. Yeah.
Jadi semuanya sama aja ya guys ya. Jadi
Yeah.
mau di Indonesia, mau di Korea, mau di every country,
every
we can
country.
fail.
Yeah,
We can fail, but
fail.
we learn from the failure.
Yeah.
Okay.
Yeah, we make more experience. Yeah.
I have some picture of actress in Indonesia. You can see it. Is it they do some surgery or not? And which treatment they do it? Okay.
Okay.
Maybe one of them is your patient.
Oh, maybe
Okay,
I think
we
so.
can see it. The first one.
Yeah.
Okay.
I think she did.
Huh?
Yeah, I think she did.
She did. She did it. Okay.
surgery.
What she did?
Only the picture. Okay. Maybe nose.
Nose. Okay.
Nose and here for the forehead.
Forehead.
Yeah. Double eyelid. I don't know exactly.
Good.
But I think she did something. Yeah. Bone surgery. I don't because her the camera angle is not.
Okay.
I'm not sure, but maybe
maybe
I don't
he
know
do
exactly.
it.
Yeah, I don't know.
Jaw surgery. Okay.
Maybe not 100% I can convince, but yeah, maybe.
You know it. She's a man.
Shaman, what is that? Really? Maybe I think so. Yeah, but you know.
She's beautiful.
Yeah, she's beautiful. Yeah.
She's a man.
Man. Yeah.
She's very beautiful, right?
She's very famous.
Yes, she's very famous. Next time you go to Indonesia, I introduce to her. Okay.
Okay.
She's very like you. Next picture. Okay. This is okay.
Yeah.
Can you check it?
Please another one. Yes,
She's a girl.
Yeah.
She's a girl. She's a woman.
Yeah. I think she did those because the cosmetic now, but I can feel she did those.
Okay.
And maybe a little fillers near here, but not much, not many things. I don't think.
Very good.
Yeah.
Very good analysis.
Yeah.
Nice.
Yeah. Really?
I like your analysis.
Yeah.
Okay, next picture. Okay. Who is she? Milan, yeah. Milan, yeah. Is this Milan? Okay. Why you are laughing?
You know him? You know her?
Yes, everything is here. It's very popular in Indonesia.
Oh, then I have to very carefully talk. Sorry, all the fans come to my Instagram. Sorry, you're all beautiful. Okay, maybe.
What she did?
Of course, she did some fillers near here, but nose surgery maybe. Only in front view, I cannot judge, but she did nose surgery.
Okay.
Yeah, because yeah.
Do you think she do chin treatment or filler or surgery?
Surgery. I don't think she got surgery, but a little filler or something. She
filler.
did. Yeah.
Okay. Maybe some filler.
Yeah.
How about her lips?
Her lips. This kind of Russian lip style and filler. Yeah, she did already filler. I can feel because the distinction in here is a filler like. And if later she will resolve in another procedure, she will want because filler sometimes expansion, tissue expansion like this. But now very beautiful. Yeah.
Okay.
Yeah.
Next picture. Yeah, he's a man too.
Mandu?
Yeah.
Man, yeah. Her eyes taking me to the camera because different photo the other man.
Okay, next picture.
Okay,
she's my friend.
Your friend?
Okay.
I think she only cosmetic, not the surgery, but only the yeah. Very natural, yeah.
I'm proud of you, bro.
Yeah, I can feel, yeah. Oh.
Wow, he's a professional.
Right.
He's a professional. Professional Chun. Okay, next picture.
No.
Okay, you may guess it first. She's my friend.
Your friend? Yeah, she got some here, right? Yeah.
Actually, this is the picture after 1 month's procedure. So it's not settled yet.
Ah.
So it's more easy to analyze it.
Ah, okay. I think she got surgery, eyelid surgery.
Okay.
Before, but need revisit. I think a little better result. And nose, not surgery. I no, silicone only, but not the tip. Many tips. But only nose dorsum, I think. Tip, I don't know exactly. I can touch. And here, maybe implant, or I think there's a distinction from the jawline. Maybe implant, or maybe I think implant was inserted.
She do it facelifting.
Facelifting.
That is because she's look a little bit
swelling.
Yeah. It's facelifting, but only 1 month after the procedure.
Yeah. Looks like the dry is swollen.
Yeah. The last one, see the picture? Very famous one.
Who is she?
Nikita Mirzani. Who's very famous.
Then I have to be more careful talking right now.
Yes, because she's must be making some story for you. Dokchun!
Really? Okay. Of course, she did eyelid surgery and nose surgery. And I don't know, maybe she did surgery here, but swelling here, and injected some polymers. I don't know, I can feel something inside, collagen filler, I think, yeah.
Very good eye.
Yeah.
Very good eye. You're very professional. I like you.
Every day I do it.
Same like me. You know, about maybe 3 or 4 years ago, I'm like you. Very active in the patient.
Yeah, really.
But now I'm active in my podcast.
Oh, yeah. You have many steps like this.
Yeah. So you're a doctor and a DJ.
Yeah.
How can you manage it? Because I think a doctor is very wide perspective. Yeah, I think it's very good perspective. But a DJ is, I don't know in Korea, but in Indonesia, DJ is a little bit bad experience, bad perspective, yeah, because it's clubbing, alcohol, girl, or something like that. Is it in Korea? There's some issue like that.
Yeah, that kind of issues maybe worldwide, because if I'm going to be, mom, I want to be a DJ, then mom will be, like that. DJ, no. But when I started DJ, I learned more violin and drum, but there's the instrument. I have to bring them and cannot by myself. But DJing, I only USB and can play. And if I only do the doctor job, then I getting older fast, because I'm doctor only surgery, then nothing. But after DJing, I would exercise more, because it's have to show the good performance and cosmetics too, and share many things artistically. Yeah. Then sometimes they give me inspiration too for the surgery. Yeah.
Okay. But I'm sorry, you cannot perform in my restaurant. Last time I told you that you perform in my restaurant, but this I forgot. This is our Ramadan. Ramadan,
yeah.
We are fast, and the police not permit. But next time you go to Jakarta,
with coffee break.
Let's perform to Sayap Suci in Sayap Suci. You drink alcohol?
Yeah, I drink alcohol.
Soju.
You
like soju?
Yeah, I don't like soju exactly, but I sometimes drink. Yeah.
Okay. Thank you very much, Dr. Chun, to coming here to Jakarta, for sharing in here. Thank you very much.
Thank you. It was a good time to see you.